Reiner Petke worries about his mom and what the Ford government's plans could mean.
That just made my heart sink because my mom's 95 years old.
She lives at home where he's her caregiver. She's already on waiting lists for long-term care. He can't imagine if she ends up hours away.
Sooner or later, there's going to be a fall. This is what happens, and inevitably they wind up in a hospital. And that's the only way they ever get onto the priority list to get in long-term care.
One expert can't believe the government's proposal.
Honestly, I'm horrified because it fundamentally is stripping the human rights of people to actually make a choice about where they want to live. You know, the only people in our society that we don't give a choice about where they want to live are convicted criminals.
This is all as hospitals are overwhelmed, struggling with a lack of staff. The government says hundreds of people have been in hospital for 6 months waiting for a long-term care bed. It plans to move 1,300 people by next March. The bill, introduced by the government, says certain actions may be carried out without consent, though yesterday the minister introduced it this way.
What the bill does not do is forcibly move patients out of alternative level of cares. What the bill does not do is force people into homes at a great, massive distance away from their families.
It doesn't specify what distances are allowed. It does say a patient cannot be physically restrained to be transferred to a home.
But you just saying, I don't want to go? No, we can still push you along unless you start physically restraining. Like, this is absolutely draconian.
He says often the homes that have space are older homes or ones that suffered the worst outbreaks and most deaths during the pandemic.
And I know many lawyers have already are looking at this and are absolutely horrified at this, breach of, fundamental justice and fundamental rights of people.
Dr. Sinha hopes to talk with the government and suggest amendments, such as requiring people to have up to 5 long-term care home choices and not allow just one. Lorenda, Reddekopp, CBC News, Toronto.